Lisa, and this is Semal, and we're here with Specialty Wellness located in the Colony, Texas. And today we're going to talk about Ozempic Face.
What is Ozempic Face?
You haven't heard of it?
No.
Okay. Well,
Never.
So Ozempic or semaglutide or tirzepatide, Mounjaro, Zepbound, all of that is of course the GLP-1s that are out on the market right now that are helping people lose weight, which is honestly a great drug. It's definitely helping with portions, with control, cravings, and also helping patients only eat when they're actually hungry and just really training them to make new healthy habits lifelong. We love those GLP-1 medicines here, one done correctly and one done with a medical professional like us here. Of course, we offer a medical weight loss here at Specialty Wellness, but definitely every single patient gets to meet with me or Dr. Nada Pauly and making sure they're on the correct medicine, the correct dose, and they're eating enough to prevent any kind of muscle mass loss. Because with any weight loss, you're gonna lose fat and then you're gonna lose a little bit of muscle, but we definitely wanna prevent how much muscle mass you're losing by eating properly, eating enough protein, and of course, exercise. But with weight loss, you're gonna lose fat. And sometimes we lose fat in our faces. So, you might notice, you've lost 10, 20, 50 pounds, and now your face isn't as round and plump. Maybe it's a little bit more sunken in. And that's what the Ozempic Face is. So basically all it is you're losing weight, but you're also losing fat in your face. And our fat in our face, we actually have little special fat pads all over our face that gives us like our lift, our plumpness, our contours. And of course, when you lose weight, you're gonna lose some of those kind of fat pads and the contours in your face.
Noted. So how do I fix that? Because I definitely, now that I'm thinking about it, I have seen, friends and family that have been on semaglutide or any forms of GLP-1, and I do kind of see that their face is kind of like squished in a little bit, or like under eyes are like completely like sunk in.
Yes.
What do you do to fix that?
So there's actually a lot of treatments we can do. The one that we definitely recommend is some dermal filler, because basically you're losing those fat pads. So dermal filler comes in and replaces those fat pads. And dermal filler, all it is injectable hyaluronic acid gel. Your body already has hyaluronic acid in its body. It already knows what it is, how to metabolize it. So now we're just replenishing that volume loss with the hyaluronic acid gel. So it's more of like a deep filler just to give structure to the cheeks, to the jawline, maybe mid-face, just to help lift everything back up. There's also a really nice, pretty product called Skin Vive. This one right here, it is made kind of for those very, very fine superficial lines. So sometimes if you lose the volume in the face, you'll have kind of like little lines here that filler can kind of help with, but Skin Vive was actually made specifically for those lines to help smooth and plump them up.
Oh, okay. So would you say like it's the normal amount of filler that I would be injecting? Like I normally do cheek filler. So like, let's say I was on GLP and I lost some weight and all of that. Would you inject the same amount, or do we have to inject a little bit more because, my face is sunk in?
Yeah, I mean, it honestly depends on the patient, their goals, what kind of look they're going for. Some people like a more contoured look. Some people like a more round look, a more square look. So it's honestly just really customizable. If you are older and if you did lose like 100 pounds, then yes, you're definitely gonna need more filler to replenish that fat loss than someone who maybe lost 15 pounds or something like that and who's in their 30s. Another treatment to help bring back the volume in the face is a treatment called Sculptra. So Sculptra is a biostimulator that's gonna actually stimulate collagen under the skin to help with that volume loss as well. Really pretty for kind of this lower face, mid-face volume loss, kind of that like too gaunt look. It helps a lot with that too. So the best is a combination of filler to like lift and plump and pull up, and then of course Sculptra to kind of fill in where it's needed, help stimulate the collagen and bring back the volume.
Well, it's good. One thing I do like about Sculptra is that, compared to Sculptra and filler immediately you'll see the results within like the next day or two. But Sculptra, one thing I do like is that it kind of reacts within the collagen inside of your face and your systems, and then slowly you'll see the difference.
Yeah, so Sculptra is something you build on. So, most patients come in every 4 to 6 weeks or so. We kind of put 1 to 3 vials to kind of see their progress and kind of see how the Sculptra worked the last treatment and kind of build on it from there.
Also very customizable, I would say.
Yes.
Very customizable.
Another treatment, if you're not into or not ready for filler Sculptra injectables, then of course we still have skin tightening options like our RF microneedling treatment. radio frequency and microneedling combined into one treatment. So basically that's going to tighten the skin. It's going to make little micro injuries to your skin so that your body does the whole repair process to stimulate collagen and elastin to help tighten your skin.
Do you feel like there's maybe other lasers that can also help with that? Or is it just RF microneedling and Sculptra and all of that?
Well, RF microneedling definitely is going to be deeper for skin tightening. But since we are very blessed to have the Ultra LaseMD machine, we can put that on top of the RF microneedling. So you do a deep collagen stimulation and then you do like a more medium superficial collagen stimulation. Oh, okay. So that one also is going to help with skin tightening, also fine lines, wrinkles, pores, pigmentation, but definitely help like smooth the skin and tighten the skin on a more superficial level as well.
Yeah, and I do have seen the results off of y'all's Instagram that the combination of the RF microneedling plus the LaseMD, the laser skin resurfacing, honestly is a better result rather than just, doing LaseMD.
Yeah, for sure.
Just that.
Because you're treating like all levels of the skin and doing texture and tone.
And one thing that I do like that we talked about this is because, some people are still a little bit like quiet and ashamed to tell other people that I am on GLP-1, and so it's good that they don't have that like resentment or that feeling of being embarrassed in front of anyone because they know that there's nothing on their body that shows.
That's true.
Because of the sunken face, it's like an easy giveaway that someone's on it.
Yes.
So that's a good thing. I will say that.
For sure. Another kind of treatment that can help with collagen stimulation, skin tightening, NAD, it's a peptide injection that is actually also like an anti-aging peptide. It's an injection you can do 1 to 3 times a week, and it's basically going to just help your body function at its best peak. So it helps with anti-aging, also helps with brain, memory, things like that, also to help you just, again, perform at like your levels.
And I've heard NAD and glutathione a lot recently. Been hearing about it almost everywhere about these peptides and, vitamins and putting it through your IV and all of that. So that's good to hear that, that can also help as well because these peptides are now growing. They're growing. Big. Yeah, I agree.
Sure. If you're wanting something more natural than filler or Sculptra, we also can do PRP because the PRP is where we draw your blood, spin it, get the plasma, which has all of the growth factors in there. So that's going to also help stimulate collagen and elastin in your own body in a natural way. When you lose weight, maybe you'll have sunken in eyes or again, volume loss here. We can definitely inject the PRP in those areas, and that is going to help with the volume loss as well.
I agree. And just remember, you're not going to see results after your first session of PRP since it is more of a natural route. Your growth factors, it takes more of those sessions to see the results that you're really looking for.
And PRP, sometimes when you lose weight, you also might lose your hair spinner. So PRP can also be injected into your scalp to help with hair health, new hair, thinning hair, loss of hair. So that also can be used for your scalp health. All right, so now you know what Ozempic Face is, how it's caused, what happens, and how you can fix it, basically. And that's either with filler, Sculptra, RF microneedling, Ultra LaseMD skin resurfacing, peptides, or all of it combined.
Right. So many out there.
So many options. So yeah, if you have lost weight, like awesome, that's so good for you that you're on your healthy journey, you're looking great, feeling great. But if you feel like you've lost too much fat in your face, you have volume loss, maybe you're looking older now that you're not as plump, we definitely can help restore your confidence there. Because you've worked so hard to lose the weight, don't you want to be we want you to be glowing and confident and just be happy with what you see when you look in the mirror.
Absolutely. We want you to see the results.
Yes. So definitely come in, schedule a consultation with us here at Specialty Wellness in the Colony. You can message us, text us, DM us, and we would be happy to meet with you and see your goals.
Absolutely.
Thank you. Bye.